my topic is physiological effect of exercise on female reproductive system. So before starting, I would like to start with actually what is FRS, your female reproductive system, which we call it. So this is your human body. You can see it's like, you can see the pelvis, the central part of the body. Here, the second sacral, you got your COG, center of gravity point. So from here, your line of gravity means you can see here in this, here you got this pelvis, and on this pelvis there is like this gap is filled by the floor muscles. These are the pelvic floor muscle, which is hammock shaped. These are like these muscles which are close back, and these muscles will help in your support, sexual, lymphatic, and due to these muscles you are not leaking. Now we come via model. As you can see, I think this is visible. So this is the model. You can see this is your pelvis, this is your pelvic floor muscle, and these are three-layer muscle. First is your urogenital diaphragm, second is your pelvic diaphragm, and third is your endopelvic fascia, which is inside. And now you can see these are the pelvic organs. First is your bladder, second is your uterus, third is your rectum. These are supported by these muscles. Due to these muscles, these organs are not falling. Due to these muscles, we are urinating without leaking. Due to these muscles, we can play on ground. Due to these muscles help in expelling out of your menstrual fluid. Now we are talking on what is actually female reproductive system. This is the female reproductive system have your these pelvic floor muscle involved with your vaginal muscle, vagina, your uterus is there. You can see, I think this is visible, uterus, and here your two ovaries are there, two ovaries, uterus, and this is your endometrium, myometrium, endometrium. So these are the lining, these are the layers, walls of uterus, and this is your ampulla, and this is your fimbriae, and this is your connected ovaries, from where your egg is released and come to here. And if you are fertilized, sperm is there, you will get your embryo is implanted here in the form of blastula, and you will get pregnancy phase. But if you are not getting pregnant, then means in a FRC, female reproductive cycle, every month a woman there is not only a 2 to 3 day cycle is going inside a woman body. There is throughout a month a cycle is going inside a woman body. This is known as female reproductive cycle, FRC in short. So in what is going in the FRC? In FRC there are two parallel cycles going on. One is in your uterus, there is thickening of uterus wall, and if you are not getting pregnant, then this wall will slough off via your vagina. And there is ovarian cycle is also there, maturation of your one follicle, and then release of your ova at the end of month. And if you are not getting pregnant, then this ova will just disappear, corpus luteum will burst, and your hormone will decline, and you will get your menstrual cycle. So this FRC throughout a month in woman body, this month can carry from 28 to 41 days. In some women, they carry their cycle, menstrual cycle by 28 days, but some carry 41 days. This is normal if you are getting your ovulation. If you are not getting your ovulation proper, then there is some kind of disorder is there. So as we can see, there is FRC is a cycle. This is a 4-phase cycle. First is your premenstrual, your menstrual phase is there. Second is your pre-ovulation phase or follicular phase. Third is your ovulation phase, and fourth one is your post-ovulation or luteal phase. So in a first phase, as we all know, this is a common phase, that is your menstrual phase. Your menstrual cycle is going on. Your all hormones is at low level, estrogen, progesterone decline, and your this wall, endometrium thickening wall, is just sloughing off via your vagina. Now there is co-contraction of your abdominal and pelvic floor muscle, and due to decline of these hormone, the pelvic floor muscle, this muscle will behave due to low level of hormone. This muscle have to expel out the fluid, so this muscle will behave too loose. Looseness of muscle is in first phase. Now when we talk about the second phase, there is now start rise of your follicular stimulating hormone, FSH hormone will starting rise, then to your LH hormone, Then there is static maturation or stimulation of your hormone is there. Thickening of your uterine lining started again due to this FSH, and you will get now ovarian and uterine cycle again started. Then there comes here your muscle will behave. This muscle will now come to its normal behavior. It will start now common relaxation and contraction phase started again. Then there comes the third phase, that is ovulation, your peak hormone day. Here your ova is released, and now your all hormone, estrogen and FSH, your LH is at surge, is at peak now on a 14 day, basically on a 14 day, but it can vary accordingly. So now this is from where your fertile period is started. If you are like getting your intimacy, your time during this day, conceive during this day, you will have more chances to get pregnant after from day of ovulation. From 5 to 6 days of ovulation, you are more prominent to get pregnant. So now there comes the fourth phase, that is your luteal phase. Here now you are in a fertile phase, and your corpus luteum is formed, which is now releasing estrogen, progestin, relaxin, and your inbin hormone. Due to relaxin hormone, your ligament laxity will be there. So due to which laxity, to overcome this laxity, your hormone will have to, your muscle, this pelvic floor muscle will have to hyperactively. Means the muscle behavior in a first phase, as I already told you, is too loose behavior. Now here they have to work hyperactively, means they are too tight muscles due to ligament laxity, due to hormone relaxin. So now we get some data ki there is not only one cycle is going on, that is female reproductive cycle, and in a 4 phases, and we have 2 parallel cycles, that is uterine cycle and ovarian cycle throughout a month. And throughout a month you will now get, I think, more clear data from this cycle. Throughout a month you are having one cycle, and you will start with the menstrual phase, then comes to the follicular phase. Your hormone is like decline, your pelvic floor muscle is too loose, then there comes there is high pitch come to normal, follicular FSH hormone is there, then LH surge is there, mean more estrogen is there, and your egg is released. Now due to corpus luteum, there is estrogen, progesterone, inbin, and relaxin is at peak. Now this is your fertile period, and you are more prone to get pregnant if you are getting any conceived chances there. And if you're not getting pregnant, that means you again comes to your first phase, that is your menstrual phase. And here your muscle is too loose, pelvic floor muscle. Here your muscle will behave normal, and into these 2 phases your muscle have to work hyperactively, means it is too tight, too loose, and here it is normal. So we plan according to this phase only. We'll plan the cycle of exercise plan. So before starting the exercise plan, explain about how you have to just go for the exercise of this muscle. Will have some benefit for the exercise, like physiological effect of exercise on a body, on our FRS system. So basically whenever we go for exercise, there are like 2 to 3 sort of exercise, like minimal exercise, moderate, and vigorous activities here. So we don't have to go for minimal, we don't have to go for vigorous, because we have to go for the moderate activity, because most of time problem is not the exercise, problem is the wrong exercise. We have to choose the exercise according to the behavior of the muscle, according to the phase of your cycle, according to the hormone level. We have to track your ovulation before, so that we can get the cycle exactly where you are standing at that time when you have to exercise, before planning your exercise. So we'll start with the moderate activity only, because whenever we are going for the moderate activity, you will feel happy. After exercise, you will have more endorphin, that is feel good hormone, and when you are happy, feel good hormone means there's reduced cortisol level, means reduction of stress. Means if you are exercising, there is less chances of getting stressed, there's less chances of getting any emotional stress, there is less chances of getting any sleep apnea. Means the hormone will induce your serotonin, that is sleep inducing hormone, and reducing your cortisol hormone. These are the effect, and it is also like decreasing your visceral fat, abdominal fat, reducing your obesity, reducing your PCOS induced obesity, and just overall weight management is there. Overall you are like feeling so good, feeling so positive about your body. So whenever we feel positive, like we feel good we are more confident in our body. We are less chances of getting depressed because of this disorder or any behavior of muscle. So less chances of getting any contractions, over contraction means less chances of getting your premenstrual distress. Means your less chances of getting cramps, means less chances of getting extra pain, which is due to these co-contraction of these muscles to expel out the fluid because of stress or your improper sleep. So exercise is overall good, but choose the right exercise. So we'll start with the first phase. In the first phase, as I already told you via this graph, in the first phase the muscle is too loose. Means if the my muscle is too loose due to expelling out of the fluid, means during this phase I have to just work on my rest part, my hydration part, and have to work on the kegels, your contraction part, your core breathe, your kegels with the diaphragmatic breathing. Means you have to just inhale via nose, and you will feel your abdomen to be protrude out, your pelvic floor muscle to touch down the floor, and just when you pursely breathe out, you will contract your muscle and try to hold this muscle, and start with a quick contraction, then with the slow contraction part. This contraction will definitely help in your strengthening part, and induce it with some relaxation or meditation part, like visual imagery guided technique. Just sit in a alone place, or just sit down in a alone place. You can start with the tension relaxation. It will definitely help. This exercise will definitely help when you are menstruating. Second then come your phase of your follicular phase. Here everything is like hormone is getting on track. Now you will have to work more on your abdominal part, abdominal muscle and hip muscle and pelvis part. So here just start with basic stretches. Just go for high intensity workout. Here you need more cycling, more warm up is needed with stretches. Then there comes the third part, that is your ovulation. You are on cloud 9 already. Just go for more aerobic activity. Just go for some Zumba dance. Go for some walking is the ultimate exercise. Every time walking is the ultimate exercise. Just go for it. And third comes a luteal phase, because as I already told you, there is due to hormonal changes, there is, you see, tightness of muscle. Here the loosening, we have to work on the strengthening part. Here tightness of, we have to relax the muscle with the accessory muscles. We have to just relax this muscle. So what we have to do, this is contracted, but we have to relax. We have to relax with the connecting with the core breathe. Your inner core muscle, your transverse abdominis, activation of your muscle, your awareness of muscle is needed. Your more relaxation of muscle with stretches of your psoas muscles, your pelvic floor muscles stretching is needed. Your glutes muscle, your all accessory muscles stretching is needed with a warm up and cool down session. So as we already discussed, this is like the phase we discussed what is this pelvis center part, and this model you can see, this is center part, this is the muscle, and what is FRS, and what is going with the FRC, what are the 4 phases, what are the 2 cycles going with the parallel hand, and what is going with the hormonal fluctuation with these cyclic changes. There like hormone fluctuation is there, decline to rise to top up level, then again decline. So this is the cyclic changes which comes every month, and if you're getting pregnant, then till 9 months your corpus luteum will work, and there is this technique of your endometrium wall will help in your embryo blastula formation and then implantation of your embryo. So progesterone, your pregnancy hormone, is already there. So this is it, and at the end when I'm covering, I would like to add on more about, if you want to learn more, learn more, there's the book name, it's all about periods by Dr. Deeksha Singh. It's available on Amazon Kindle, and in ₹99 only. This is my gift to every girl around the globe. If you want to get this book, carry all evidence-based assessment and research data-based treatment plan for the basic first aid treatment plan for if you are getting any disorder, then how to deal with it. If you are getting any kind of irregularities, how to deal with it. So this book is my gift to every girl around the globe. In ₹99 only. You can just have it if you want it. This book is for every girl. If either you are menstruating or not, either you are of any age group, just read it. It will be beneficial for you, because it carry the proper diet plan, lifestyle plan, and your exercise plan too, with supplemental data. You can just read it and have, if you need more query, just go with your respected doctors around the globe, or you can just contact me for this. So before end up, I would like to add on something ki there's like menstrual product, there's more confusion among girls nowadays about the menstrual product. Ki there's like we are living in a marketed area, ki some kind of like sanitary napkins is there, menstrual cup is there, tampons is there, and reusable pad, reusable liners, panties are there. So which one is a good option? So good option, if you ask me, I'll just suggest for the menstrual cup. But if you don't know how to put it, you are going to definitely, if you don't know how to put the menstrual cup, how to rotate it, how to just keep it in a place, you will definitely going to hurt your muscle, your vaginal muscle. You are definitely going to hurt this muscle. So just you can just also go for reusable pad, which is also a good option, and which is you can just go for, which is hygienic too. And if you are using the sanitary napkins, just try to keep it in a proper disposable manner. Just don't use it for more than 24 hours. I seen in some girls they are using it. This is not good for your hygiene purpose too. So there are a number of things you can just use, but tampons is not so beneficial. It is like in case of tampons, menstrual cup is great, but you should know how to use it. So these are the things, and from this I'm like winding up my words and winding up my things, and thank you so much.